tibia, and fibula. You have your ACL, MCL, and PCL that are tucked into the knee that you're going to be working on the scar tissue all around it. And you can have a tear in any of those ligaments. Is it a full tear to where the tendon has folded back up? There's nothing that we can truly do for that if the tendon has folded back up. They do need to get some form of surgery where they attach it, because it's gone, it's completely severed. But if there is a tear, that's why I say always go for like an MRI to just get an idea of what's going on in the knee after the injury. So then it's like, oh no, there's a little tear within the ligament itself, but it's not severed. That can heal. I'm going to get them on good minerals. I'm going to get them on the iron and calcium. I'm going to lovingly open the scar tissue around the area to bring proper lymph and blood flow to it. It's going to restructure that and heal so much stronger. Anybody who has had knee surgery or has that, oh, it's bone on bone, the cartilage is still there. The cartilage dehydrates, and then in my body, because it's an inflamed area, I don't want to live in pain. So my body's going to steal now some calcium and some minerals from my femur, my tibia and fibula, the surrounding bones, to buffer down the inflammation there. And it's like, wow, all I see is bone on the x-ray, because that's all the doctor actually can see. The cartilage is there, but it's masked by the bones that we've removed from our bone density to protect the joint. So it's just the domino effect that we go. And so I'm going to go in and I'm going to lovingly pull apart those fibers. I'm going to get them to hydrate properly. I'm going to get them to put some compaction on that bone. I'm going to get them to do nice resistance band exercises for the tendons and ligaments. Re-strengthen.
Can I say something?
Yeah.
We're going to go in there with cell sonic regeneration, and we're actually, did you know that if you go in with cell sonic regeneration, you'll fracture any displaced calcium because it is not strong. Okay, all calcium, metabolic calcium that's pulled from the bones. And remember, how many people are going, Grandma,
because it's going in a love harmonic, though. It can't break a bone that's a bone. It breaks the excess calcium that's on the bone.
25,000 volts is in a love harmonic coming out of the cell sonic regeneration. It'll fracture the actual displaced calcium, creating ionization. So when you go in and you're actually using your elbow, you felt it, Tom, everybody here that's had non-surgical, you can feel the calcium breaking like crackers. And it's actually, then the ionization takes place. And then we can actually get the calcium back in the bones if we can get the people to go on calcium ion therapy like Merigen. All right? And then with the scar tissue, when you pull that apart, now you can get the life force back in there. Remember something, every cell is 0.04 volts. And every cell in there that's calcified, blocked, or has scar tissue, it drops its voltage. All we got to do is bring the voltage back, whether it is a physical injury or even a critical disease. You can turn a person's life around just like that. Remember something, people are not falling and breaking their bones. Their bones are breaking and then they're following. And guess what, if you don't believe me, why don't you do a stat on last year? How many children under the age of 12 fractured their arms and their legs? That should not be happening.
All right, everybody. So 7 minutes face to face, 7 minutes face to feet, but I'm going to be starting 5 to 6 inches above in the quad. I'm going to take my time opening up that muscle belly, but muscle bellies are so easy to work. People are like, ooh, how do I look at a chart, look at the way the muscles go, and you're going to work a 45-degree angle stripping that muscle belly. You just never want to feel like you're flicking over it. But my focus is not that, it's all in the joints. So as I work my way through the middle, medial, and lateral section of the quad, my focus point down here is that quadricep tendon. That quadricep tendon helps that leg expand and feel supported when I'm standing. And so now I'm going to take my time, and it's middle, medial, lateral on that quadricep tendon because it gets really thick too. And then generally you should have a structure to your patella, your kneecap. You should feel like there's a curvature around that bone. Some people's you're going to feel like it's just kind of masked off on one side over the another, and that's that excess calcification buildup. And so we got to re-carve out around that patella. So I've done middle, medial, lateral through the quad, focused on the quadricep tendon. And then I'm going